Cauda equina is a back condition that can happen in many different contexts. It can happen from the minorest thing, rolling over in your bed, bending over. It can happen during a surgery. Cauda equina is when a piece of cartilage or a piece of bone in your back breaks loose and gets caught between the bony portion of your back and the spinal cord. It's dangerous. It happens quickly. The problem is this, is when that piece of cartilage or that bone breaks loose and gets caught near the bone and the spinal cord, it causes the spinal cord to swell. There's no place for this bone to go. As the spinal cord begins to swell, it presses harder on the bone and it causes more and more damage. It works on top of itself. When you present to the hospital, make sure you let everyone know your conditions, whether or not you're having pain into your legs, whether or not you're having some loss of control of your bowels or your urinary tract, whether or not and when it happened. There's a 48-hour window in which treatment must be made immediately. Many physicians, even when they know about the medical condition and even know it's Cauda equina, treat it as if they have plenty of time in the world in which to do something. They don't. It has to be treated quickly with surgery to relieve that pressure within at least 48 hours. The faster, the better. Many times I've had cases where the doctor will even do a surgery or a piece of bone during the surgery, which is a known condition. It can happen during a spinal surgery, but then that piece of bone gets caught in the spinal cord. You have to complain quickly. In my case, the case I handled, they did contact the physician's office quickly. His staff did not tell him of that condition, and more than 48 hours went by and he was permanently injured, loss of bowel, loss of walking, permanent pain. There's also a time when they just don't treat it fast enough. You come into the hospital, they know it's Cauda equina. The doctor, they fool around, they don't get a specialist. The specialist decides maybe to wait for whatever reason, who knows, and then the condition is permanent. I've handled many of these Cauda equina cases. We've won millions of dollars for our clients. If it should happen to you, and you get a poor result or a bad result due to the negligence of a physician or the staff or the people reporting to the physician, give us a call. We can determine whether or not we can help you.